Well, AIDS Vancouver Island here, our harm reduction services in Victoria is the primary service for people who use drugs. We have about 2,000 people who have accessed our service in the last couple of years, and we're one of the only spaces in Victoria that is really specifically for people who use drugs. So we exist to serve people who use drugs, and we're welcoming of them, and that's our focus, and that makes us unique, I think, amongst health and social service providers in Victoria. We distribute a lot of safer drug use and safer sex supplies. Last year, AIDS Vancouver Island in Victoria distributed about 570,000 sterile syringes, and we recovered almost the same amount from the community. So making sure that those syringes go out, also come back safely.
This is our front desk where people will come and access the service. So if you need any gear, you'll first be entered you'll be greeted with a hello, and then we try to touch base with people coming by as we can. We try not to just let people go by, because the whole idea of the program is connection.
Because people experience so much stigma related to drug use and related to their health status, it creates understandable challenges around trusting health professionals. And when you have people who come from a peer perspective and who've had some of the same life experiences around drug use, sex work, poverty, it makes it a more welcoming and less intimidating environment.
So my life experiences, like with prison and addiction, all that stuff, really plays in favor in this, because I get to really understand. Like, I know where people are coming from. You know, I've been there. I've suffered a lot of myself, so I know grief and trauma, all the abuses, from emotional, sexual, physical abuse to homelessness to health-wise as well. I've had multiple different, like from MRSA to cellulitis. My family, my mom and my dad, I'd lost basically everybody by the time of 19 to drug use, right? And so, I mean, it's been straight from birth. So I really connect with people as well. So, like, I speak their language, so we really connect. And I'm inspiring to them as well, right? Like, if someone can see someone come up from where I did, it gives them a little bit of hope.
Stigma has a really huge impact on people's health and well-being, and so there's not a lot of places for people to physically be in Victoria if they are seen or perceived to be a drug user. And so providing a physical space for people to just be and connect and be social is really a big important piece of what we do.
Yeah, so we have all the nursing gears stuff in here. Unfortunately, we don't get a nurse as much as we need. We don't have it 5 days a week. It's Monday and Friday for a couple-hour windows, but they can come in and just generally check in with folks and do the smaller stuff. Obviously, we don't have a lot, but we get a job done, and we can serve their health care needs as much as possible.
We've been operating here as harm reduction services on the 3rd floor of the Access Health Centre for the last couple of years. And in the 2 years that we've been operating from this space, we've had over 2,000 individuals access the services. That's an incredible number when you consider the physical space that we have to deliver our programs from.
Obviously, our first aid, which we carry, we always have our naloxone supply on stash and our first aid supply. And we have an AED here, so we got everything we need in case of an overdose, which we see the likes of, obviously.
We're in the middle of an overdose crisis, so we are seeing unprecedented number of overdoses and overdose deaths across the province, and I would say across the country. That's no different here in Victoria, and I think what we're seeing here with our harm reduction services is a microcosm of what's happening elsewhere. So the number of overdoses that our staff have attended to here on site from January to March of this year, 2016, was around the same number that we responded to in 2014 and 2015 combined. So the numbers that we're seeing rising across the province are also happening here locally. And thankfully, we've had no deaths here on site because our staff are incredibly well trained and they know how to identify overdose risk and what to do when it occurs. So a big part of what we're doing, both with our staff and also with the people that we serve, is making sure that they have that information and that they have the tools that they they need to support their peers. So we're part of the Take Home Naloxone program, which is a program of the BC Centre for Disease Control. And over the last number of years that we've participated in the program, we've trained almost 1,000 people to learn about overdose prevention and response. And we've distributed over 600 to 700 take-home naloxone kits in the community. There's a few different ways that we engage with folks to provide information that's going to help them stay as safe as possible. One of those is called Street School, which is a really accessible, fairly casual class that we do at least once a week, where folks who are spending time in our drop-in are invited to come into our classroom essentially and learn about issues that are important to them around their health, around what's going on in their lives. And a lot of that is health information around HIV and Hep C prevention, how to stay as safe and healthy as possible if you're living with HIV and or hepatitis C. I think that our community is really ready to include supervised consumption services. We know that there's a lot of support out there. And I think for a lot of people, a harm reduction approach really does make a lot of sense. It doesn't make a lot of sense to give people supplies for safer drug use and then not provide a space for them to do so.